Hello, and welcome to my presentation. My name is Sonia Neri, and this is the neurotransmitter serotonin. In this presentation, we are going to discuss the main properties of serotonin, where it is found, and receptors involved in the transportation. We will learn about one psychiatric diagnosis with deficit of serotonin and one psychiatric diagnosis with a surplus of serotonin. We will also discuss one drug class that increases the effect of this neurotransmitter and one drug class that decreases the effect of serotonin. So, where's serotonin in the brain? Serotonin receptors are divided into 7,5-hydroxytryptophan families. Serotonergic neurons in the central nervous system are found primarily in the midline Raphe nuclei located in the brainstem from the midbrain to the medulla. You see the illustration as indicated next to it. So serotonin is produced by the decarboxylation and hydroxylation of tryptophan. And serotonin is also involved with the sleep-awake cycle, appetite, memory, as well as learning. And it's basically known as the substance of being and happiness, well-being and happiness. So this is an illustration of the 5-hydroxytryptophan, also known as serotonin. So low levels of serotonin causes depression, anxiety, irritability, PTSD, OCD, and the discontinuation of medications with serotonin may cause a discontinuation syndrome. That means if you are taking an SSRI and stopped abruptly instead of weaning it slowly by decreasing the dose of the medication, symptoms such as increased anxiety, sleep disturbances, and other sensory disturbances may occur. In this illustration as well, you see that hyperstimulation of the postsynaptic serotonin receptors causes serotonin syndrome. Serotonin syndrome occurs with a surplus of serotonin. In this illustration, you can see that the symptoms can be mild to life-threatening. So some mild symptoms of serotonin syndrome, nausea, diarrhea, fever. Patients with serotonin can also have high fever, leading to hypothermia. They can also have muscular hypertonicity, clonus, altered mental status. Signs of excessive serotonin ranges again from tremors, diarrhea, like I mentioned before, to all these neuromuscular signs and symptoms. Adverse drug reactions that result from therapeutic use or intentional self-poisoning or inadequate interaction between drugs can all cause serotonin syndrome. In order to treat this syndrome, the medication needs to be weaned or decreased or stop rapidly in order not to cause death. And serotonin syndrome is a clinical triad with all these various mental status changes. it is important for the clinician to be aware and not dismiss mild signs of serotonin syndrome, and also be aware not to prescribe SSRI with MAOIs or some opioid and analgesia such as Demerol or weight-reducing medications or antiemetics. And also make sure you are aware of any other drugs that the patient is taking or herbal supplements prior to prescribing any SSRI. The best way to treat serotonin syndrome is supportive care and sometimes administration of cyproheptadine in moderate to severe cases. So some drug classes that affect serotonin, like mentioned before, selective serotonin reuptake inhibitors, SSRIs. These block serotonin transporter, preventing reuptake of serotonin into the presynaptic neurons, thereby increasing serotonin in synaptic cleft. It makes it more available for the body to use. SSRIs, example is paroxetine, Paxil. It's one of the most effective medication for treating depression, and it's a phenylephrine derivative hydroxytryptophan. An antagonist for serotonin is cyproheptadine, brand name Periactin. It's an antihistamine and a potent 5-HT2A antagonist used in treatment of serotonin syndrome as well. These are my references. Thank you.